It is a huge honor for me to be invited to the home of Stephen Goldstein, who we're on Memorial Day weekend in his man cave, and you're getting a very private viewing of his man cave. But I can tell you, being out here in Arizona since 1987, what year did you get here?
1990.
1990, so I was 3 years ahead of you. He's absolutely the most remarkable dentist of all of Arizona. And when anybody ever has a very high-end, very complex, when you just have to have a Lamborghini, this is the man who does it. And you've been doing it forever. Thanks again for inviting me over.
Welcome. It's my pleasure.
So tell my homies your story.
So the story goes back to about 1987. Actually, it goes back before then. So I went to dental school at Georgetown. So I was in Georgetown from DC from 81 to 85. And then in 1985, I met my mentor, who was Neil Starr, who was part of the faculty at Georgetown. And what happened was I was finishing dental school, and Neil gave a lecture at his office and invited me. So I said, sure, I want to hear what you have to say. So I listened to his lecture, and when he was done, I went up to him and I said to him, I just finished 4 years of dental school and didn't understand one thing you said. Like, what did I miss, and where did you learn this stuff? And he started laughing, and the truth was, he did the perio-pros program at the University of Pennsylvania, so he was a periodontist and a prosthodontist, and he had all this advanced training, and I just got sucked into that deeply. And so what I would do was I'd work as a general dentist, let's say 2-3 days a week when I was first starting out. And then 1 day a week I'd go to Neil's office and I'd watch him work. And I would just stand there almost, the whole day for weeks and weeks on end, just trying to figure out how does he do this? How does he do an amalgam? How does he, place composite? I mean, just some basic stuff, but I was just blown away. And that's when that bug hit me. And so he suggested, would you consider going back to school? And I really didn't want to go back to school for 3 more years. And actually today it's a 4-year program. And so imagine after you finish dental school, do you want to go to more school? I thought it was going to work and that was going to be it. And so I applied and luckily got accepted, and that was the start. So I was at Penn from 87 to 90.
In Philly?
In Philadelphia, correct. And then in 1990, I left Philadelphia, and actually my sister got married and moved to Arizona a few years prior to that, and then my family came out here, so that's how I made the Arizona.
Now, where were you born and raised?
New York. Born in New York City.
Now, when you say New York City...
in the city, and then we moved...
So in the city means Manhattan?
Yes, in Manhattan.
It's a crazy town.
Yes.
When you go to New York, you hear New York City, but when you get to New York City, there's no New York City. It's either Manhattan, Brooklyn, Bronx,
Correct.
Queens. What's the other one?
Flushing? No. I forget.
Yeah. So you grew up in Manhattan?
Well, no. I was born in Manhattan, lived there until I was 1, and then my family moved to Brooklyn.
Brooklyn, okay.
So we lived...
And then Bronx.
Actually in Bensonhurst. So we lived there until I was about, how old are you in second grade? About 5 or 6?
Or six is year 1, so you've been 7.
7.
Yeah.
So I moved to Long Island when I was in second grade. And then so I went to...
Manhattan, Brooklyn, Long Island.
So then I stayed, and actually I stayed in New York through high school. And then I went to college in Ithaca. I went to Ithaca College. So I was 4 more years in New York, but upstate New York.
Yeah.
Which was great. And then Georgetown Dental School, so right after college, directly to DC, which was wonderful. That was a great dental school. It's sad it closed.
So you did a 3-year perio-pros program.
Correct.
Now, did you, I had never met anyone who did a perio and a pros program. I mean, that's
you probably
as
have.
rare as a unicorn.
So, no, well, like David Garber.
Okay. In Atlanta, Georgia.
Henry and Maurice Salama. Henry did the perio-pros program, and Maurice did the perio-ortho program. But Penn had all these combination programs.
And they started a high-end office in Atlanta.
Right. So they work with Ronald Goldstein in that office. So it's Garber, Goldstein, Salama, and a couple of other doctors.
There's 2 Salamas?
Yeah, there's Henry and Maurice.
Oh, I just know Maurice.
Yes, so Maurice started Dental XP.
Right.
And then Henry, he still lectures all over the world.
Huh.
Yeah.
Well, send an email to all your homies. Tell them that I want to podcast interview them.
Oh, they're great.
All after you. Yeah, I'm a big fan of Maurice.
Yeah.
I think what he's done with Dental XP is amazing.
Fabulous.
Yeah.
Absolutely. It's like what you did. It's absolutely fabulous.
And so then you decided to come out here because your whole family left New York
Correct.
and came out to Scottsdale.
And I like the weather. so I'm not a big
Because you're a big
cold-
bicyclist.
Right. Actually, I was just on the bike this morning.
And it was in, I remember running into you back in, no, you were lecturing at the Scottsdale Study Club.
Correct.
And you were high as a kite because you had just biked with Lance Armstrong.
Right. That's right.
I don't think you could have been more
Right.
more excited about that. Tell us about that.
It was actually a mistake. The U.S. Postal team came out to Arizona to do a fun ride for their sponsors. So it was like Trek, Nike, Oakley, etc. And they just did this fun ride. And the day before, I happened to run into two of the guys on the Postal team, and they said, "Hey, we're starting out at I think it was the Princess Hotel, tomorrow, and we're doing this big ride. Just show up and come with us." So it was like Forrest Gump. I jumped on, and it was like if you saw the line of cyclists, because the word got out that the Postal team was in town, so it was just like hundreds and hundreds of cyclists. And I actually rode 1 inch behind him for about 20, 30 minutes, and then I got up next to him and talked to him for a couple of minutes, and then I thought, I don't want to be the dentist that takes out Lance, because everyone was trying to get near him. I mean, imagine, we bump wheels or something, and Lance goes down, and so I just backed off. And
Now, was he always one of your idols? Because you're a huge cyclist.
Yeah. Yes.
And
Yes.
is he still one of your idols?
We talked about that for a long time. Yes, I still think he's an amazing athlete. What he did, and that's his deal. He has to deal with it.
Well, on the podcast before you was an Ironman athlete, Michael DeTola.
Oh, okay.
And DeTola said that when he read his the doctor that did the doping thing, the doctor said that it's kind of they actually focus more on diet than doping, and that they were more into calorie counting. The diet.
It's
nutrition.
the whole. I mean, let's take the drugs out of the equation. You still have to train, 24 hours a day, 7 days a week, which includes resting, diet, on the bike. So, whether you agree with that or not, I don't want to go there, but the bottom line is he's still an amazing athlete. And I enjoyed watching every tour. We didn't know, in the early tours, the guy comes back from cancer, he's almost dead, and just the fact that he can even be in a bike ride or race is pretty amazing, and then let alone win.
Let's not get sidetracked on Lance, but I want to add one thing, because I love history. It's just, all you got is what's going on now.
Sure.
And the history. And in the history of the United States 100 years ago, when doctors were trying new medications, they'd ask for volunteers. And all these volunteers would do it. And I think it's so sad that the government spends all this time trying to crack down on doping, when I'm a big believer in transparency. I think they should legalize all doping for all sports, so that 1 million U.S. physicians who are trying to get an 80-year-old grandma to get out of her wheelchair,
Right.
and grandpa who can't walk up the stairs, and they here you have, you're not doing monkey studies. They say you're doing humans,
Right.
who are, if they just logged everything and logged all that data, I think what all these NFL players and Olympians are doing, everything would apply to help the senior citizens be better athletes.
It could.
And they're just trying to walk up a flight of stairs.
Right, it could, but it'd have to be a huge policy shift.
I know.
That's a whole other story. But yeah,
But they should do that, because you can't transfer data on a rhesus monkey and a chimpanzee to grandma.
right. And I don't judge what anybody does. Like I said,
Yeah.
Lance has to deal with that, but I still think he is an amazing athlete, and it was a lot of fun to watch.
And started an amazing foundation.
Right. He did a lot of good and motivated a lot of people. So, I'm a little disappointed, but
Yeah.
it's like I said, he has to live with it.
So I want to go on something. So you and I have been doing this for 3 decades, and when we got out
That's
of
scary.
school,
You'd think we'd be retired by now.
well, we both could be retired. I mean, come on. I'm in your man cave. I don't think you and I have to work another day of our lives.
I do.
We do it because we love it. But here's the deal. So when we got out of school, only 5% of dentists didn't take insurance, and 95% took indemnity insurance.
Right.
Where I would just take my cost, add a profit, send the price to insurance, and they just paid the percent, what they were going to pay. 3 decades later, it's no longer cost plus profit, pay a percentage of my price. Now the insurance company sends you the price on a PPO.
Right.
82 out of 100 dentists take these PPOs. The PPOs are about a 40% reduction. And so we saw income in dentistry peak at 2005 at $219,000 a year, and now it's down to $174,000. So we've slid $45,000 a year on the average net income. And then there's they always say it's lonely at the top. So here you are at the very top, the top. You're the number one guy in Arizona. You don't take insurance. you're talking, podcasters are generally under 30. So you're talking to probably 10, you're talking to thousands. I mean, sometimes these things are what we last week, these were getting like 33,000 views on Facebook alone. But coming out of school like that, can somebody do that in 2016, what you did in the 80s?
Honestly, Howard, and this is great because I like to pick your brain a little bit too. I don't know. And so think about this. I moved here in 1990, and I followed my teacher's model of practicing. So I learned from them, and they would give the patient either a case fee or they didn't accept insurance as the primary payment. Like we will fill out the forms for the patient, but they get reimbursed. So they're paying us directly. And, just fast forward to 2016, I mean, I don't know really what's going on in the insurance world and what, the statistics that you just said. I'm not aware of that stuff. I mean, I basically just go to work every day, try to do my job and go home. So I haven't, I'm really not up on what's going on that way. And then, I start hearing these things now, and it's mind-boggling to me. Because I don't know how to, let me say this. Here's one thing that I've learned. Human beings, that the people that we treat, there's two things they want. Everybody wants to look good, and everybody wants to be able to eat. Would you agree?
Absolutely.
Right? So I can have a patient, it could be
I picked just one out of two. Okay. I want to eat so bad, I gave up look good.
Okay, but here's the deal. I've had patients, they come in, they've had a stroke, and now let's say it's a woman, and she's in a wheelchair. Let me tell you this, the caretaker has put on her makeup, she looks nice, and she's not going to leave the house unless she looks good, and that's just a human characteristic. So what's interesting to me is, even I volunteered at that AZ Mom event, before Christmas. Are you familiar with that? We do free dentistry for 2-3 days on anyone who wants it. And what was interesting is I was in the restorative department, and so a lot of dentists or hygienists were taking impressions, and the laboratories that volunteered, they were making flippers, and I was inserting the flippers. You would think someone, let's say they're missing 4 teeth, okay, and I insert a flipper in their mouth, and you hand them a mirror, and they say, I don't like it. But it's free, and you had no teeth before, but they still don't like it. They want to look a certain way. So what's interesting to me is, regardless of what we get paid, any of us, for any procedure, I still think you have to perform and provide a product that the patient's going to like, which means it has to look, decent enough so that they'll leave. What are your experiences with that? My
experience is that, everybody's afraid of corporate. It's like 12% of the U.S. market is corporate, and everybody thinks that's the bad guy because they feel the tension. The tension is really the change from indemnity insurance to PPO. They've lowered their fees 40%. But anytime I meet anybody, a consumer, and I say, hey, I'm a dentist, I just want to tell me your life story of dentistry. Nobody is retaining their patients. I mean, if a hygienist worked 40 hours a week, 50 weeks a year, that'd be 2,000 hours. So she could see 1,000 people twice a year. Well, 25 new patients a month, 1,000 divided by 25 months, it would only take 3 years, right. And you'd fill up your hygienist and live happily ever after.
Right.
But you go to that office 3 years later, 6 years later, 9 years later, they still need new patients. Right. Well, how could you be putting new patients on your hygienist schedule if old patients weren't falling off? And then you go to the other end, you go to the patients, and they haven't even, they've seen 6, 7, 8 different dentists in the last 3 decades. So nobody's retained, corporate, they can't even retain their dentists. Right. I mean, some of these corporation chains, their dentist doesn't even stay a year. So I think that this, let's get on an assembly line, let's do discount dentistry and blah, 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 blah. That's probably worked maybe for half of America. Mm-hmm. But anybody who wants a nice car that costs $30,000 a year or all the way up to Mercedes, Lamborghini, there's always room at the top.
Right. I agree with you, but I feel the pressure every day to perform at a high level, even if it's a single molar crown. I mean, I could be humbled where, there's no contact or something goes wrong. I mean, it happens to me too. So it's just the fact I don't leave it. So if I do something and it doesn't work, I do it again. But it's time consuming and it costs money. And in certain cases, you don't make a profit. And I think I have the same problems everybody else has. But I also don't think you can automate dentistry. That's what's interesting to me. So here's something that we can look at with some slides is I do every case, every complex, or let's say anterior aesthetic case twice. I do it once in plastic So I make provisionals, I get the tissue worked out, the shapes of the teeth, the patient likes the way it looks, and then we go to the final materials. I don't know how to do it one time. And if someone does, I'd like to learn how to do that because it's very time consuming to do the cases twice. But what I find is, here's my thing. I don't want surprises at the end. I want to know that the case is going to be inserted and go uneventfully versus you get to the end of a case and now the patient says, I think the veneers are too long and I don't like the shape and I don't like this. And I've had that happen. And so I'm convinced that you have to do a mock-up first, make provisionals, and then go to the final case.
Well, that rule number one in prosthodontics, which you are, is you should work out all your problems in the provisional.
Right. But I think the general dentist should be doing the same thing. I mean, I don't see how you don't do that because here's the thing. If you're not getting paid a lot of money or you are getting paid a lot of money, either way, you don't want to do the case twice. So how do you avoid that?
So let's talk. I called my podcast Dentistry Uncensored because I kind of like HBO, where they don't have to worry about the time, they don't have to worry about advertisers, sponsors. Sure. We see about 12 to 14% of the U.S. dentists have gone to CAD/CAM.
I love. Okay.
Talk about that.
I call it CAD can't.
CAD can't. I have not heard that. Can we name this podcast CAD can't by Dr.
CAD sometimes can and sometimes can't. I mean, that opens up a great topic, okay? And I don't even know where to start with that.
I want you to start. And the reason I keep coming back to this subject is these kids, probably 20% of my listeners are juniors, seniors in dental school, and the rest are probably 5 years out. So they're coming out with about $350,000 in debt, and the powers that be is saying, well, you're $350,000 in debt. You need to spend another $150 on a CAD/CAM, another $100,000 on a CBCT, and another $85,000 on a laser. And these kids email me every day saying, do I have to double my student loan tuition by making 3 purchases? Or would you say just buy a good bike?
Oh my God, I'll summarize this really fast. I don't have a laser, I don't have a CAD/CAM, I don't have a CT machine.
CBCT.
I don't have any of that. I don't need it because I don't do surgery anymore, so the surgeons own that equipment. Do I want to mill a crown? Explain the math to me. How do you buy a $150,000 machine to make a $200 item? And who makes it, and what's your time worth? So I don't get it yet.
So they graduate $350,000 student loans and then spend $150,000 to be demoted to a lab tech. I thought you came out as a doctor.
Okay, wait.
Now you're a lab tech.
And let me say this: who's designing the crowns? And what's the learning curve with this? So I'll give you an example. I've had in-house dental laboratory technicians full time work for me. Okay, so let's go back.
Or has?
I don't right now. I have had a few times in my career, and it's great and it's bad. There's pluses and minuses to it. Mostly good. So let me give you an example. I had a technician come in, and we were thinking about getting into this whole CAD/CAM world. Because here's what was happening. We were getting items back from laboratories, and it doesn't matter, multiple different laboratories, very high-end laboratories. And we'd open the box and we'd say, why'd they do this? Like, who designed this abutment? How come this isn't good? How come this is that way? We couldn't figure it out. And so we were on this quest to try to figure out, is it the technology or is it the person using the technology? And we didn't know. So we decided, let's get a 3-shape scanner, a laboratory scanner, and design our own abutments.
A 3-shape scanner?
Yes.
Out of Scandinavia?
Yes.
Where are they out of?
I think that's
Denmark?
Yes. Okay. I think so. But they're not in America.
Scandinavia.
And so we decided, let's start slowly with this digital world and get into it. And so we started designing abutments. And I'm telling you something, Mitch and I together really know a lot about dentistry. So here's what we decided. Here's our bar. If we could make it better by hand, we don't need the machine. Okay, so the minimum quality that should come out of a machine should be what we can do by hand. Would you agree?
Yes.
Right? So if we're waxing something and we get a wax it back from the machine, it should be as good or better. And then it should be faster and cheaper. Right? So it should be better, faster, cheaper. That's how I look at the technology. So like, for example, I'll digress for a minute. Let's say intraoral impression making. Explain to me how you spend $40,000 for the machine. It takes longer. It costs more money. And I don't think it's any better. Okay, we can argue it might be technically better, but if I'm producing impressions on a daily basis for $3 to $6 each in 3 minutes, and having no issues or relatively no issues with things fitting, why do I need a $40,000 machine?
Now, are you using stock trays or are you doing custom trays?
Okay, so yes to both. I am using, matter of fact, if you go to my website, or
What is your website?
I can even show you. It's
Stephen H. Goldstein, DDS.com. And the H should have stood for Howard, but it doesn't.
It doesn't.
My
I'm
gosh,
sorry. But let me just show you this. So
Polyvinyl siloxane.
I've been using PVS since dental school, so 1981. Okay.
Are they all the same, or do you like a particular brand?
I use Kerr and I use GC products and 3M, and so in this particular case, let's say this: the way to do this correctly is in a 2-stage technique. I don't even know if most dentists know that. Okay, and I'll demonstrate that in a moment. But most doctors will mix the putty and inject the wash around the teeth and just put the tray in the mouth and just hope for the best. And if you do that, what happens is the putty is so heavy it displaces the wash. So what I've tried to come up with is, let's take a stock tray, let's take the handle of the mirror, and I'll enlarge the tooth preparation area, and then let me inject the wash directly into the unset putty and see what happens. Okay? And even when I did that, if you look carefully, the wash is displaced by the putty because the putty's too heavy. Okay, so here's the way the material is supposed to be used in the 2-step technique. And this is demonstrated on my website. I have a PDF that you can download. Actually, I didn't say this. On my website, there's a tab that says for doctors, and the password is 6th molar. 6THMOLAR. I'll make a slide for you.
Oh my gosh.
Okay. So if you click on that, then you can.
Homies are so lucky.
Then you can download the handouts. Okay. So this is the way it's supposed to be used. You take a stock tray, you put the putty in the tray. Okay. Simple. So you mix equal parts of A and B together, and then the putty comes with these cellophane spacers. Okay, and the next question everybody asks me is, where do you get the spacers from? They're in the box, and it's probably the first thing your dental assistants throw in the garbage or in a drawer because they don't know what they're for. So basically, you take the spacer. If you don't have the spacers, you can take a Ziploc freezer bag and cut it into a, roughly, 2-inch square, 3-inch square, and that's it. Okay, so you put the spacer on the putty, and then you insert that in the patient's mouth. Now, my dental assistants do this. So you just asked me, do I use a stock or a custom tray? Well, I start out with a stock tray, but I just customized it. So now when the putty is fully set, you have a rigid custom tray without sending it to the laboratory. Okay?
Nice.
Simple.
Nice.
It's simple.
By the way, my number one fantasy in life right now is that you create some online CE courses for us. You are a legend.
Okay, we'll
dude.
talk about that.
You got to capture what
we could.
It's all about sharing,
I love to share, but
from the best at the top to the youngest, and what makes me more passionate is sharing from the richest 20 countries to the poorest. There's dental schools in Africa, Asia, and Latin America where they say basically their entire curriculum is the 350 courses on dental.
Wow,
because everything else they have is a 20-year-old textbook.
Sure, but you know what? That's still valuable. I mean,
yeah.
I think that they're lucky that they have access to that. I mean, that's why the internet's been the greatest, really, invention of our lifetime. It's sharing information globally.
Yeah.
I mean, how cool is that? I mean, look, I go on your site, Dental XP, Facebook. I have 15 or so hundred friends on Facebook. I can't even pronounce their names or their countries where they're from, and they're posting images of dental work that's blowing me away. Stunning.
I know,
Stunning
from Russia,
stuff.
India,
Stunning.
everywhere.
Ukraine, Brazil. I'm blown away at how talented people are out there.
I know.
So anyway, so then what I do is I inject the wash into the custom tray. I don't inject around the teeth in the mouth. Because you ever do a full arch impression, let's say 14 units. So you start on tooth number 2, then you go to 3. What happens to the material around tooth number 2 as you get to number 4 and 5? It starts dripping down, going down the patient's throat, and you're just hurrying and you're going like this, and it's a very stressful procedure. It's not fun. So anything that's not fun, I don't want to do anymore, and I want to figure out a better way to do it. So check it out. So you inject the wash into the tray, okay? Insert the tray in the patient's mouth, gently insert it. You don't want to get drags and pulls, so you want to put it in their mouth first and then vertically push it up if it's an upper, and then look at the quality of the impression. Okay, I can do this 99% of the time, It's not perfect, but almost every single time I can get this quality. And if you notice, the wash is not displaced by the putty.
Few questions.
Yeah.
A lot of them they ask, do you dry off the teeth before you do?
Okay, so step one, patient has photographic cheek retractors, and they'll hold them in their mouth, which will keep their cheeks white. I personally work with 2 dental assistants at all times. So one is working chairside with me, and the other one is supplying us with the materials. Okay? And then, so the patient's sitting, let's say at a 45-degree angle, they're holding the cheek retractors. You've made your custom tray, the material's fully set, and now all you have to do is inject the wash into the tray calmly, hit your timer, and then insert it in the patient's mouth, and then slowly push up.
And what's the timer?
4 minutes.
4 minutes.
About 4 minutes.
So, did you air dry the teeth off?
Oh, I'm sorry. Yes. So the teeth they're not desiccated, but yes, they're air dry.
Because a lot of old school dentists think that when you have to dry off the teeth and you have to put the wash and you have to blow it down and you're blowing it down and
I don't do any of that. It's just again, if you find something that works, stay with it. If what you're doing is working, you don't need to change. But this is so predictable, and what I like about this, which we'll get into the next segment of really where I'm going with this, is my dental assistants could do this. Okay, so if I'm doing, let's say, a veneer case, let's say you come to me and you want, X number of veneers. I need amazing pre-op models. My dental assistants will do this 2-stage impression technique on you, and they do it as good as I can do it. And so that's the next thing that I'd love to digress into, or not next, but whenever we get to it, is staff training. So you mentioned, do you need this equipment? Do you need that? Do you need all this stuff? How about know what you're doing and train your staff? Because that is the most valuable thing I've ever done. So I basically work with mini lab technicians in my office. So my dental assistants could do stuff that's amazing, which enables me to do more work at a higher level.
I've always thought that at every seminar, the right half of the room is all individual dentists who come alone to save money. And then the other side of the room, every row is an entire dental office. I mean,
right.
The dentist, the assistants, the hygiene. I mean, the receptionist is the one
right.
answering the phone, answering the questions.
Right.
And the dentists that educate their whole staff, they do twice as well.
Absolutely right.
In every metric, from quality
yep.
to finance,
yep.
than all the ones saving money.
I couldn't agree with you more. And so, I'm going to Seattle this Thursday. We're doing a course, and we're having it in a dental laboratory, and it's the doctors are bringing their staff members, and I'm going to train their staff members how to do lab work.
Nice.
And here's what's funny. So everyone, the younger guys out there, or girls, you can't do enough lab work because this is an arts and crafts profession. It's hands-on. And so every case is unique. If I have 10 patients and they all need tooth number 9 done, I can't use anything from patient number 3 on number 5. So it's unique to everybody. And so you can't know enough what goes on in the dental laboratory, which gets us back to the CAD/CAM stuff. So
let's go back to the laboratory. So when I got out of school in 1987, and what year did you get out of Georgetown undergrad?
85.
85.
And then I practiced for 2 years,
okay.
General dentistry in the D.C., Virginia area, and then I went to Penn.
There were 15,000 labs in 87. Now there's 7,500.
I know.
A lot of it's gone to China, and a lot of big labs, like Glidewell, gone to CAD/CAM.
Oh, absolutely.
And Jim Glidewell told me that, when I got out of school, a good lab man could make 5 crowns a day by hand. Now, with CAD/CAM, that same person could make 50 crowns a day. Are you using labs to make CAD/CAM, Bruxers,
we're playing with everything.
So
get back to the CAD/CAM story. So I bought a 3-shape scanner, and Mitch and I decided
how much is
that was about $35,000,
okay.
Roughly. Maybe.
So you had to sell your bike?
No, I kept the bike. I had to sell my car. So, but here's the deal. So I decided we couldn't decide should we buy the scanner?
You keep talking about Mitch.
Yes.
That's your mentor from back home?
No. That was Neil Starr. So
Neil Starr.
Mitch is a local lab technician that I work with, and then there's Rick and Tom. They're all my friends. So
are they in one lab?
No, they're all in multiple labs.
Okay.
Yeah.
And so Mitch is your lab friend.
So Mitch worked with me directly in my office for the last couple of years. And so we decided to go on this journey, on the CAD/CAM journey. So here you have, an experienced dentist and an experienced lab technician, and we've made everything from scratch. Like, for example, when implants came out, I've only made custom abutments because they didn't make stock abutments initially. So we used to cast everything from scratch. I mean, I'm just used to doing everything manually. So our bar was, it needs to be as good or better than we can do manually. And so what we found is, well, let me say this. So we couldn't decide, should we buy the 3-shape scanner and mill or just design? And so we decided, let's start out with just the design and let other people mill, because it's one less thing to worry about. And also, it's another $20,000, $30,000 for a milling machine. And so here's what I learned. It took Mitch about a year learning curve to learn how to use the software proficiently, okay? And here's an experienced lab technician who's designed, oh my God, thousands of custom abutments, soft tissue models, crown, you name it, he's done it. Okay, so really after about a year, we started feeling comfortable with the software and being able to do what we want to do. And then what we learned this, Howard, and this is mind-boggling to me. If I give you, or you and Ryan, a thumb drive with a Microsoft Word document, and you both go home and print it on 2 different printers, you go to your office, you go home, you come back with the document, it's going to be the same, right? If I send a digital file to you and you're 2 different milling centers, I'm getting 2 different products back. Did you know that? Totally different products.
Because of the human interaction with it?
No, because milling, so the digital file is the same from the 3-shape. Milling's an analog procedure. You're cutting out zirconia from a block of material. What milling machine do you have? So your milling machine might be, a $15,000 one. Yours might be $500,000. Okay, and then the machine has to be calibrated to the 3-shape machine. So it's exactly like printing a digital color image. You ever buy a digital color printer? And you're looking at the screen and here's the blue, and you go to print it and you're like, this doesn't look anything like my screen. Like, what's the deal with this? You have to calibrate your software to the hardware. Well, that has to happen with every milling center. So what's not good is that you can send one file to 5 different labs. All the products are going to be slightly different. Like for example, the desktop machines, Cirac, Sirona, their milling machines can't mill with, I mean, they're always improving the quality of the burrs, but initially the burr sizes were larger than the professional ones, so they can mill smaller detail or more detail into the crowns. So there's just a lot that goes on in the digital world, and I want the viewers to know that you don't just, it's not like pressing Command P and you print out something and you make 50 crowns a day and they're amazing. Okay, then the other thing is who's designing. Okay, that's huge. So on the 3-shape scanner, let's say you need tooth number 19. There's a library of hundreds of tooth number 19s. Which one do you pick? So like, for example, a good designer will pick a number 19 and he'll look at, let's say, the contralateral tooth, number 30, and say, you know what, look how flat the cusp tips are, or this is bulbous here, or this is convex or concave. And then you can pull points and adjust it. So I can promise you, if Glidewell's producing 50 crowns a day, those guys are not sitting there and finessing stuff. They're basically banging them out. And so they're going to get a very generic product. Doesn't mean it's bad, but it's not going to be that, wow, that really looks like my tooth. And so this digital world is very interesting to me, because we've received products back from laboratories that were just awful, and we'd send them back. And they'd say, oh, we don't know how that happened. The milling machine wasn't calibrated, or something went wrong. But we've had things that don't fit, things that are supposed to be. So the bottom line of all this is you have to know what you're doing. So you still, as a dentist, so you did lab work in dental school, right? You know how to evaluate stuff. So if you get a crown back from Glidewell and it's a Bruxer, if it goes on the die and it goes like this, it could be that it's not fitting properly. It can be milled tighter. So there's all these parameters that are adjustable. So if you get a crown back and it looks great and it fits great, that's great. But you have to evaluate it as if it were made by hand.
I like what you're saying. You want everything to be faster, better,
cheaper.
and cheaper.
Right. So if we have all this, if we're automating stuff with milling machines, why is the price going up? Why should it cost me 40 grand a year? And here's another thing that they're doing to us. So if you buy an intraoral scanner to take impressions, you can't send it to any laboratory that you want to. So like, for example, my laboratory might not be able to accept files from certain scanners. So he might need to send it to a different lab to have it decoded, if you will, and then he can work on the file. There's a lot of workarounds that are going on.
I went to Creighton in Omaha, and Warren Buffett came and talked in our class back before anybody knew who Warren Buffett was. This was like 80, 19, it would have been 80. And Warren Buffett said 95% of CEOs spend all their time trying to make everything more complicated and more expensive and less profitable. And so it's the human condition.
Right.
Like how much does that impression cost? $15?
Right,
and
right,
they'll say,
exactly.
Well, I can fix a $15 impression. I'll buy a $35,000 scanner.
Right.
And then like a lab bill, that lab bill is $100. Well, I'll buy a $150,000 machine.
Right.
And then they come to you and say, well, Howard, why is my overhead high? Why are my so back in the day, the average dentist had an overhead of 50%. Today it's 65%.
Right. And that's not
their
good.
income's gone from 219
Right.
to 219 to a 174, and they're still lining up in groves to buy $85,000 lasers. How could you do dentistry without a laser? Should you have your license taken away?
Isn't it funny? Like I said, I can't even imagine what I would do with it. What would I do with a laser?
Well, I think you need light amplification, stimulation, emission of radiation.
You know,
to.
I mean, it's interesting. I mean, I don't do any surgery, so if I did surgery, I might want a laser. But I don't need that. I'll tell you what you do need. You need an amazing handpiece. Okay, so electric handpiece is wonderful. You need LED lights.
Whoa.
You need loops.
Slow down, homie. You just said 83% of our listeners are in the United States, and they all use air-driven. And you just said electric. Okay, so you're there. You're the minority there.
I love electric handpieces. You have a lot of torque, and they're just great. And also on the slow speed.
Explain more. What do you mean when you have a lot of torque?
So there's a lot of power. If you want to cut off an old crown, there's a lot of torque with the electric handpiece. I used Cavo. I mean, I'm sure there's other brands that are good. And then I love the fact the slow speed has water and light. So my old slow speed had no water, so I was relying on my dental assistant to spray the tooth as I'm working on it, which basically.
So you have a Cavo high speed, slow speed.
Yeah.
Both have light and water.
Yes.
And everybody knows with the air driven, sometimes you're cutting on a tooth or a crown and the burr will stop.
Right.
But not with electric.
No, there's no, right. The torque is phenomenal.
But a lot of people say that, with the air, it's more kind of, it's a different feel. Electrical's different
It's
feel.
definitely a different feel. I mean, when I first got it, it was a little heavier. I noticed that, but now it just feels great. And I can still feather edge with. I mean, it's really nice. I like it a lot, and I dial the speed down or up depending on what I want to do all the time. But being able to see and have water on the slow speed is amazing.
Do you wear loops?
Yeah, and I have 3 power loops.
3X?
3X, yeah.
3X power loops?
Yeah.
What brand?
I think it's designed for vision.
Do you have a headlamp on your head?
No, because I have an LED 8X light. And so that thing is so bright, and it has a button that it's...
Talk about that. So you're talking about the overhead?
Yeah, overhead light is LED.
LED.
So think about this, in Arizona especially, no heat, which is phenomenal.
LED 8X light.
So no heat, and it has a filter so it doesn't cure composite. So you can still work with the light on, it's orange, but you can see what you're doing.
So is that the whole arm?
Yeah, so it's on a track on the ceiling.
Oh,
and
it's
it
a
slides.
track light.
Yes. So I replaced the head unit on my, I had a halogen lamp
On
the track, and I had that removed, and I put in the flat LED 8X light. Oh, it was phenomenal.
Did you ever go to Oregon and see the ADEC plant?
I did actually, years
Holy
ago when I
moly.
bought my equipment.
What was his name? Ken Austin or Ken?
I don't remember. They flew my staff and I out to ADEC.
That is amazing. You go to the ADEC factory, what an American story. It's a long building, and on one end, it's just raw materials. It's like leather and
Right.
beads and copper, and you just look at the end,
Yeah.
you think it's something that goes in a barn. And the other end comes out the best dental
amazing
chairs
stuff.
in the world.
Amazing.
And then his hobby, this shows you how cool this guy is. So his hobby was restoring old cars that he found himself out in the middle of fields and
That's
just
great.
to mint condition. And of course, I show up with 4 boys, and they were like 3, and they just ran to the cars and started climbing all over him. And all of his employees like, "Ah!" And he's like, let him play. And I'm like, no, get off. But God, he's so cool.
That's funny.
So cool. So LED lights.
So obviously, I mean, it sounds so silly, but it's nice to see what you're doing, right? And see it big. And
Well, that's one thing some people say they like about the oral scanner is that when you're scanning, they're seeing the image bigger on the computer screen.
yes, Like I said, I'm not going to say I'm anti-technology because I don't want it to come across this way. But I've played with everything early on, and I'm still experimenting with things. But like I said, I have a bar, and it has to be better, faster, and
cheaper.
And cheaper. And the thing is this: why do I want to spend $45,000? And here's what also kills me: then there's a $2,000+ licensing fee a year.
Oh, yeah.
Where'd that come from?
They ding you every.
So it's like if I buy a Nikon camera,
I know.
every time I press the shutter release button, I'm not sending Nikon money.
I know.
Okay, so I don't.
It's
I
like
don't want
it's
it.
like it's
I don't
like
want
they
it.
went to school for 8 years to figure
Right.
out how to run their overhead to the ceiling.
Right.
It's like, are you a volunteer, dude, or
Right.
did you want to get your dental school tuition back?
And here's the thing to me, we can have a discussion on this. Does it make you better? So if I'm producing this, like I said, I'm not perfect, but 98, 99% of the time, I don't need the new technology that costs more money until it's faster, better, cheaper.
Because at the end of the day, dentistry is a science and an art.
Right.
And some people can do it with watercolors, some can do it with
Absolutely
paint,
right.
some can do it with digital. But can you do it better, faster,
Right.
and cheaper?
And then do I want a mill in my office? No. I mean, two reasons. Number one, who's going to design the crowns in my office? So how am I going to work all day long?
Your dental assistant,
Okay, so
who's made
That's-
3 crowns in her life.
they have, I mean, I'm not saying they couldn't do it, and I'm sure you could train them to do it, but by the time you train them, now they're a lab tech.
But do you think a dentist could train a dental assistant to be as good as a lab man
No.
sitting at the bench?
Absolutely not. No.
Even
it's
close?
not-
Even close?
I always
No.
say no because they have 20, 30 years of experience.
And the volume they do daily. It's just like a general dentist doing a denture. He'll do 5 fillings a day. He gets good at that. But if she only does 1 denture a month,
Right.
is she ever an expert in dentures?
No.
Every time I start a new denture, I'm always like, oh God. Okay, okay, you're going through your mind like, how are we going to do this again?
Right.
But you don't ever think like that with a filling or a crown.
No, but if you want to talk about dentures, it's funny because I lecture on these topics, and I have found that most dentists don't understand the lab side, and when you don't understand the lab side, it makes it hard for you to do your job chair side. So, like, I don't have an idea, but let me ask you this: when you make a denture, do you use a processed base? Do you know what that is?
A pride, I don't know.
Okay, so here's what's wild. You don't know what a processed base is, and I use them every case. And all you'd have to do, even if you don't know what it is, all you have to do is write on the lab slip, please provide me with a processed base. And what that means, if I showed you the denture technique that I use, it couldn't be easier, and you can do it tomorrow. It's just you don't know what you don't know because you've never seen it. And that's how I look at my goals.
So this is an online course you'll be making soon on
We
Dental
could.
Town, available on your iPhone?
We could do that. My hesitation is I'm pulled in so many directions. I don't
I
have
know.
time. But I would love to do that. But like when I teach dentists,
My job is to guess. I have 2 jobs. One is to guess the questions the viewers have, and the other job is to shut up and not interrupt you. Can you name some labs for my homies? Any good labs that you can plug that you like?
yeah, I mean, all the labs I use are local. So there's Rick at Lafayette Dental Lab, Tom Wyand, Mitch Nussbaum, it's MN Dental Laboratories. That's who I primarily work with, but there's a lot of good labs in town. But again,
What's the lab in Seattle? You're going up there?
It's Issaquah Dental Lab, but I'm not using them. In other words, the course is going to be held there.
Yeah. How much are you lecturing these days?
A lot, probably 25, 30 times a year.
If you put all that on Dental Town, you never have to leave home again.
That's nice. So I can
need
do
to talk to his wife
I can
and
do
kid.
This, I can do this more.
Yes,
Okay. So, but I love teaching, and what I'm finding is, and especially for you new doctors out there, go to the dental lab and watch them work. That's my best advice for you.
Do you remember the old German out here? What was it, Wolfgang?
Yeah,
Back in the 80s?
totally. I totally remember him.
Is he still?
I don't know. I think it was Continental Dental Laboratory. It might
You know,
have been.
that was the best day I ever spent in my life. I was using different labs and whatever, and I called him up and I said, was mine good? And remember his German accent? How'd he sound?
Yeah.
And he's a German accent, Wolfgang, and he's like, and I said, but anyway, long story short, he took me under his wing. He said, well, come on down here. Was it Continental Lab?
I think so.
Yeah, I think it was Continental
I
Lab.
think it was.
And they love it when you're humble. Go down there, see what they're doing,
totally.
and I learn more
Right.
with listening to him Because the bottom line is, I come out of school in '87, and obviously, by the time I spent the whole day with them, mine was the worst impression of the day. You know what I mean? No doubt. But by when I talk to labmen, they're afraid to call the dentist.
Okay, but that perpetuates this mediocrity in our whole profession. So here's the deal. If I send any of my laboratories an impression and it stinks, they call me and they say, hey, I can't use it. Can you take another one? And I say, okay. And I'm not happy about it, but I just do it.
Because he doesn't fear that you're going to cancel your $5,000 a month lab bill. That's
but so here's the deal. So they don't call you, then they produce the product, then it doesn't fit. Well, now what? Now you do it again anyway.
So you need to do two things. You need to call your lab man and say, hey, when you meet someone off the street and you say, describe a dentist, physician, or lawyer, what adjectives would you give? Where would the word humble come up?
It should.
It should, but does it? But does it?
No, but it
should.
If
you went to the gym and said, I got a lawyer friend, give me 3 words to describe him.
Humble probably wouldn't be one of them.
Yeah, so you need to call him up and say, hey, I'm humble. If you don't like anything, or you think I need to come spend the day with you, or
you need to spend time with your laboratories. And so here's my point. If you're going to get into the CAD/CAM stuff, then you need to know what you're doing. So how do you learn how to design crowns? You wax teeth. Oh, no one wants to wax teeth anymore. And so if you came to my dental office, which we're actually remodeling now and building a big lab, I can wax crowns. I have a porcelain oven. I can do all the basic laboratory work that I need to do, and so could my staff. And that's
Are you
huge.
solo in there?
I'm solo.
How many ops? How many square feet's office?
Well, I'm remodeling it now, so it's going to end up being 5 operatories and maybe 2,700 square feet, roughly.
And of those 5 ops, how many of those are hygiene?
2.
2 hygiene, so you work 3.
Yes, and I really work 2. I mean, I don't see a volume of patients.
So in their monkey mind, compare the size of the lab compared to how many operatories would that be? Is your lab, would that be about the same size as 1 op, 2 ops, 3 ops?
Oh, probably 3.
So your lab is the size of 3 operatories?
Probably. Well, I mean, minimum 2. Let's say 2 and a half or so. But I have all professional laboratory equipment in my.
And what are you doing there?
Everything. I mean, like for example, do you make a provisional restoration? Right. So you need acrylic. You need a bench where you can sit down. You need light. You need to be able to see what you're doing. I have a porcelain oven. If I try in a crown and I need to add the contact, why do I want to send it back to my lab when I can do that in 20 minutes? You know, things like that are just basic laboratory equipment, but I have pro gear. So like if I want to polish something, I have a Cavo, it's huge, it's probably 4 feet wide lathe, and it has lights in it and built-in suction and filtration, so I have...
Is there anything the Germans didn't think of?
Oh, it's amazing.
Did you ever go to the Cavo factory in Germany?
No, that I would have loved to.
It's in a very small town, and the houses all look like the ones we had under the Christmas tree, with those big old steep roofs. Yeah. And the Germans, they all walk to work no matter what the weather was.
That's great.
And they're the most organized, hardest working people.
Yeah, isn't that great?
The Germans and the Japanese, those are 2 peas of the same pod. They just work hard.
Yeah.
And everything has order.
Yep.
Everything is order. And when you go to German and Japanese factories, when you come back to America, you're like, oh my God,
right.
This is kind of embarrassing.
But that's how your dental lab in your office should be.
Yeah.
You should have a place that, like my lab bench is probably the size of this table. Okay, you need to be able to sit down comfortably, see what you're doing. I have electric handpieces, vacuums. Like for example, do you have a steamer at your office?
A steamer?
Steam clean.
Huh.
I couldn't live without it. So every implant part, think about this. Every implant part that you take out of someone's mouth and you're going to reinsert, you want to clean it. Okay, so you can throw it in the ultrasonic, but everything is steam cleaned. So it's extra clean, and the steamer blows all the debris and the grit off of anything you've polished. I mean, I couldn't live without a steamer, ultrasonic. Like I said, if you want to come to my office and see the lab, you can take pictures of it and post it online if you want to.
I do.
But these are the basic things that you need to know how to do. So like, for example, my dental assistants pour models every day. Do you have a vacuum mixer in your office?
No.
We vacuum mix every model. I don't see how you can't. So then they're not distorted.
For the stone, you're talking about vacuum mix for the stone.
Yeah, exactly. So it's like if you would learn 2, 3, 4 little lab things to do, and let me tell you this, Howard, it's harder to do it wrong than it is to do it right. So if you hire a dental assistant and they take a scoop of powder and then they stick the bowl under the sink and start making a mess, you have distortion. So now your models are horrible. Now you try to mount them, then you send them to the lab, and they're looking at your models. And I'll tell you this too, your labs will work to the quality of what you send them. If you send them nice models and neat and clean, they realize this doctor knows what he's doing, I have to perform at a higher level.
Absolutely.
So, like...
I got to tell you this, so some doctors never have a remake. So you've been sending an impression for 10 years, you never had a remake, then when Charlie starts on day one, he gets your case.
Right.
Now here's this anal guy that has a 6, 7, 8% remake deal. They keep him up with the guys who've been there for 30 years. So when you've never had a remake, and you look at the lab scripts, I mean, 95. Have you gone to that removable partial laboratory in Nogales, Arizona? It's one of the biggest.
No, I haven't seen it.
Removable partial casts, because a lot of labs outsource the casting.
Okay.
So they're doing like 1,500 units a day, and 95% of the impressions sent in, the doctor didn't even cut a receipt.
Yeah.
It's
I'm not
just
surprised.
It's just an alginate.
Right.
Or it's like so if you write something on the lab script other than A3 and you prepare a receipt, I mean, if you just show them that I give a shit just a little bit, they'll try harder.
Exactly. But here, so here's the bottom line: how good do you want to be? So like you think I'm an amazing dentist? I just think I do the basics.
No,
really
I think
well.
you're the most
really
amazing.
I really think I do the basics really well consistently, and that's what's being good. Like for example, I studied with when I want to learn how to do veneers. Okay, that was very intimidating for me because I was at Penn and we were doing all these large crown and bridge cases, but I never really made a veneer. You know, if I did, it was 1 or 2. And so now I come to Arizona and you have some, young, gorgeous girl that walks in and she wants 10 veneers and is willing to spend a lot of money. I was petrified. And so how did I learn how to do this? I studied with Ed McLaren. I studied with, he's friends with Klaus Mutertes, a lab technician. Pascal and Michel Monnier took their courses.
USC or is that UCLA?
No, I went they're at USC now, but
USC.
I went to that in San Francisco, IDEA. So I took the Pascal Michel course at IDEA, and it was like 4 days. And guess what we did most of the time for the 4 days?
What?
Lab work, waxed, provisional. So it's all arts and crafts, hands-on basic stuff. If you can't do that stuff, you can't be great at dentistry. I mean, unfortunately, it's arts and crafts all day long. So how do you get those skills unless you do them? So when when your classmates say, "Oh, you don't need to do lab work," it's just sent out, and the machine punches out the crowns and whatever. It does, but not at the quality that we can do by hand. Or how about this?
If your work was a car, what would it be?
If my what?
If your work was a car, what would it be?
Oh, what kind of car? I mean, I would like to say Porsche.
Porsche.
Like high-end precision. Like Porsche's not the most gorgeous car in the world. I mean, my cases are very pretty, as much as they can be. I mean, some are a 10 and some are an 8, but I want that quality there. I want the fit and finish to be really, really good, as much as possible.
I see you went with a German car.
Yes. Yes.
I want to go through some more questions. And sorry to be bothering you on Memorial Day
you're fine.
weekend in the man cave.
I'm happy to be
But
here.
I'm just trying to raise you emails I get, questions on Dental Town. They're a senior in dental school. You did a perio and a pros dressing. What if she's thinking about going to perio school or pros school? I doubt she wants to do perio school and pros. Are there still perio pros?
Yeah, Penn still has the perio pros program, and I think Washington.
Does that come with a
Seattle has perio pros program.
So she's asking, should she go to a perio pros program? Should she? We'll talk about them separately, then combined. Should she become a periodontist? Should she become a prosthodontist? Because you have to admit, you're in the rarest. There's 9 specialties. There's 10,000 orthodontists, 5,000 oral surgeons, 5,000 periodontists, 4,000 endodontists. There's only 1,000 prosthodontists.
Yeah, it's a hard question to answer because the whole model's changing. So like you asked me earlier, who's like all these specialties used to be referral based. Now, if you ask the periodontist today, are the GPs sending their cases to the periodontist for scaling and root planing? No, they're doing everything in-house. And so
for 40% less on a PPO.
Right, although they bought a $200,000 laser to do that. But I don't know. I think the models are changing. So I don't know if it's going to be referral based as it used to be. So it's hard for me to recommend going into any specialty if you think that's what it's going to be. Now, having said that, if you want to go into a specialty because you want to learn that specialty and combine it with other things that you like, then yeah, it would be a great thing to do. But I don't know from an economic point of view if the model still works.
So if you got 100 new patients, what percent of those would come from dentist referral versus patient referral?
I'd say
Or
80% of my patients, 80% would be referrals from other patients, and probably 20, maybe 25% from other doctors. And I told you before we started the interview, because I lecture a lot now, I'm getting a lot of referrals from doctors that are out of state that patients are moving to Arizona, or they're in Arizona. So that's increased a lot over the last couple of years. But mostly it's been word of mouth. If I treat you, I'd say, Howard, who does your wife go to? And then hopefully I'd
Luckily, I don't have one.
be able to see her. Who's your girlfriend go to? Okay, anyway. But but it's mostly...
I traded my wife in for 2 cats, and I'm much happier now. I don't think 1 cat could have handled it, so I went with 2 cats. I kind of divvied it up. So we've talked about, let's talk about the provisionals. Do you take talk about provisionals? That's
okay. So let me show you this.
You up the ante saying you should solve all your problems in the provisional. 12 to 14% of the dentists were saying, that's why I went with same day dentistry CAD CAM. Let's talk provisionals.
Okay. But let me just ask you this. Same day dentistry CAD CAM. So how long is a patient in the office for?
Well, I know the lecture circuit says, we do these an hour and a half, but
I find that hard to
9
believe.
times out of 10 dentists telling me we've been doing this for 3 years and it's still taking 3 or 4 or 5 hours to do this.
Okay, let's say 3 hours. I would want to kill myself if the patient's in the chair for 3 hours. What am I going to do with them? It's just not my model. I don't want to deliver same day dentistry. And then the other thing is this. I always want a plan B. Okay, I'm not perfect. Like I said, I'm very humble. I can have, anything go wrong at any given time. I can adjust a contact for sometimes 25, 30 minutes. I can have things that don't fit, or things could fly and it works great. So I have every problem that every dentist has. So here's my deal. If I have the patient there and I promise them I'm going to deliver your crown today, and they took off from work, okay, and now it's hour 3, and I go in the room and the shade's not right, or something's not right, I'm devastated, okay? Now what do? Do you say, I'm going to remake it for you? Do you put it in when it's not right? Or do you remake it and then spend another 2, 3 hours? I just don't like that model.
Everyone says that when dentists are making their own dentistry, they're cementing stuff that they would never have accepted from the lab.
Okay, so then...
Do you agree with that or not?
I don't know, because
I hear that
I don't
all
know
the
that,
time.
but if that's the case, then to me, why would you do this? And then if you don't put... So let's say you put it in. I just cut off a crown on someone who had CAD CAM dentistry recently. He said to me, it never felt right. I don't like it. And he paid me full price to remove it and make another one. And we made it by hand. And actually, I made a provisional first just to make sure he liked the provisional.
Are you talking about the one I made on Ryan?
No, it was an older guy.
Oh,
it's not Ryan. And I removed it. He wore the provisional and liked the provisional. Then we take impressions of the provisional, copy the shape, Emax monolithic crown, done.
Okay, talk specific about a provisional. Are you taking a pre-impression? What materials?
I do it all different ways. So let me show you this first, before we even get to provisionals. So, and I'm sure you've studied or gone on Spear's website or Coyce. I mean, if you think about this, who are the leaders in our field? Would you say Spear, Coyce, name who else? Who would like the top?
I want to hear from you.
I'm not one.
Come on, I've interviewed 400. You name.
So
Coyce and Spear, that's the top.
You know who Christian Coachman is?
Absolutely, from Brazil.
Stephen Chu, Dennis Tarnow. I mean, to me, those are like the world leaders.
Pascal Magne.
Yeah, all those guys.
Yeah.
Okay, Pascal Michel, Klaus Mutertes, who's a lab technician in Germany. It's phenomenal. Ed McLaren. I mean, like I said, the list goes on and on. I've studied or watched videos or attended lectures of all these people, and what do they all have in common? They do this. They make mock-ups first. So they want to know what they're doing before they start, and they want to know that the patient's going to like it. It gives you and the patient a preview of the final case. And then, once everyone accepts that, then they make provisionals, and they work everything out in the provisionals. Not necessarily the shade, but the tissue contours, the final preparation, thicknesses of materials, basically all the things that the lab tech needs to know, the length of the incisal edge. And then after that, the laboratory can copy versus design in porcelain. And when you do these steps, things go well. So if this girl came into your office tomorrow and said, I want veneers, what would you do? Would you just take the burr out and start prepping? I mean, how do you know what she's going to like? And this was my dilemma. I used to do that. I would start drilling on teeth and say, okay, we'll figure it out in the lab or the provisionals. And then I'd get the final case back. How fun is it to try in 10 veneers? Okay, I mean, the patient has to be laying down and they're like little fingernails, and you tell them, okay, don't move, and then you hand them a mirror and say, do you like them? And they like, I don't know. And then
there was another dentist, Stephen Goldstein,
okay,
who was doing amazing veneers. I heard that I put in one of the greats. Remember Stephen Hayes?
Yeah.
My gosh, that guy,
Yeah.
that guy could do cosmetic dentistry.
Yeah. What happened to him?
He moved to Austin.
Okay.
Austin,
Yeah,
Texas.
I do remember that.
Yeah.
That name. But anyway, if this was your patient, what do? Okay, and here's the thing. The teeth are worn, without going into the whole diagnostics of this case, but the teeth are worn. The bottom line is this. How much longer do you make them? And the bottom line is, we don't know. So why not take a study model? And this is what my staff does. So we want to talk about making money. I don't need to take the alginate. Okay, I don't have to do the wax up. I don't have to make the Siltec.
Your dental assistants do the wax up?
Yes, they can.
How long have they been with you before they can do things like that?
A couple years. Well, they've been with me longer than that, but I'm just saying, if I trained someone in 6 months, actually, let me say it this way. If I trained any of your dental assistants in 1 day, they'd go back to your office being better. Now, here's the thing. This is a tiny little wax up. It's the incisal edges. Even if they do it and it's not that good, the wax is on the teeth. I can sit with it and just finesse it. Okay, so they've done the bulk of the work. That's amazing. And that's time management. So if you want to make more profit, like you were saying earlier, if your overhead's going up, why not train the staff that you already have working there that you're paying to do some of this work? And the truth is, they like to do it. So look, they vacuum form a model. The model is dead on perfect. They can do the wax up, or I can do this kind of wax up in 15 minutes, but you have to have a waxing unit and wax and all the materials. And then to use Siltec, it's like laboratory putty. So they make the Siltec jig, and then we take Luxatemp. Check this out. Patient comes back, and literally in 15 minutes, we do this. Okay?
Wow.
And that's exactly what I want them to say. If I don't hear wow, then something's not right. Okay? And this is so easy to do. So now, let's say she likes this. Now, this is my starting point. Okay, that's what you'll look like when you're done. And then the other thing we didn't talk about is I'm photographing everything. I teach digital photography courses, and I'm taking pictures every day.
But what's your camera?
Nikon. It's funny, I have a Nikon D200, which is obsolete, but the lens and the flash system are current. So it's the R1C1 flash system and the 105 millimeter lens. And I'm taking pictures and portraits every day, all day long. I can take this portrait in 1 minute, literally 1 minute, with minimal amounts of gear. I've listened to some of your podcasts about photography, and I agree.
Say you listen to them all.
I've listened to them all.
Every one of them.
I tried to, though. And so you have to be able to take great pictures. That's another thing all those doctors that I mentioned and lab technicians have in common. They're photographers. So you need to be able to do that. And then I want to show the patient, okay, here's what you look like. Here's what you could look like. Do you like it? And if they're not sure, I'll email these images to them so that they can show family members.
Why do you use Luxatemp? Who makes Luxatemp, and why do you use it?
Luxatemp is the brand. It's a BIS GMA product. And the reason I like it in this instance is because it doesn't shrink, and it doesn't heat, and it doesn't smell. So like if you wanted to try jet acrylic, you wouldn't get as good a result as quickly. It could be done, but this is an easy product to use. So basically, how hard is it to inject the Luxatemp into the Siltec and place it in the patient's mouth and wait 6 minutes? That's it. I mean, there's just no magic with this. Okay, so now you have a patient who says, wow, they're excited to do the work. Now everything is based upon this. Now I can prep the teeth based upon the incisal edge position. I know the thicknesses, and then just go through then it's all mechanical. That's it. So This is something different.
And this is all on your website?
Some of this is on my website, and I'll add
Stephen H. Goldstein, DDS.com.
.com. Yep. And I'm constantly adding PDF papers.
In Scottsdale, Arizona.
Correct.
So do you work on a lot of dentists?
I wouldn't say a lot, but quite a few.
For sure.
Yeah. And I'm also doing like cases like this.
Would you call yourself a cosmetic dentist, a periodontist, or a prosthodontist? What would you call yourself?
Well, I'm a general dentist that does all the above. Honestly, I don't care about the title. I mean, my job is to go to work, provide a service for patients.
Well, let me
do it well and go home.
Do you do root canals? Do you pull teeth?
Oh no. So there's more things I don't do than I do. Okay. So I don't do any endo. I don't do anything surgically related anymore. And the reason is, I mean, as a periodontist,
you used to place a lot of implants.
I've placed implants. I've done thousands of surgeries, and here's what I've learned over time: it's not cost effective.
Right.
Okay. So I'd rather do what I do well, and we have systems in my office that my whole staff knows. Imagine this: you have to do a root canal. That's a whole different setup. Okay, I don't even know. Do you have a microscope? And the endodontist office look like Star Wars today. You need all that gear. Then after that, you're going to place an implant. You need all of that gear. Okay, and then after that, you're going to bond in 10 veneers. It was killing me to try to keep up at the highest levels with everything, and so I just decided I'm going to work with a team. And
that is where it has to be going. In 1900, there were no specialties.
They didn't need to.
And healthcare was 1% of GDP. By 2000, healthcare was 14% of GDP, and there were 58 specialties with the MDs and 9 for us. And 3 decades out of dental school for me, you have to start shedding stuff up because you can't keep up with everything.
I mean,
you have to do a team approach. Going forward,
unless this is your hobby, like I find like the doctors that want to design crowns and make them in their office, they love doing it. That's cool. If that's your hobby and that's your thing, then of course do it because you're interested in it. But with like implant surgery, doctors ask me all the time, how come you don't place implants? You can be making so much more money. Not really. It's so time consuming and it's so involved. And then here's the other thing too. You have to deal with all the complications. Okay, so drilling the hole through the guide stand is not the hard part. It's the treatment planning and dealing with all the patient issues from their medical history to lack of bone.
Would you say this going? We've been doing this 3 decades. Would you say 3 decades more? It'll be so complex that the average dentist will even have to shed off more than they are today.
Yeah, I think it's totally going that way.
Yeah, so do I.
Like to me, a general dentist would be the hardest specialty because you're required to know everything.
It's actually, it has to be going away because there were only general dentists 100 years ago.
Right.
And now there's 9 specialties that take a quarter of the market. So probably over the next century, they'll probably take out the market. You couldn't even physically read every article each month written on bone grafting.
Exactly right, Howard. So to me, why do you want to do that?
Yeah.
Like think about this. When we were in dental school, and I graduated '85. That's not like 400 years ago. There were 3 materials. There was gold for the patients who could afford it. There was amalgam, which was our workhorse, and then there was composite. And we didn't use composite in posterior teeth early on. Okay, now think about how many brands of zirconia are there? How many brands of porcelain are there? How many brands of composite are there?
Let's specifically answer that. When you and I got out of school, it was all PFMs.
Right.
You and I have lived through pretty much the PFMs almost.
The heyday of PFM. I mean, I haven't made a PFM in, it could be 10 years.
So what should my homies? 96% of crowns are made one at a time. If you were doing a crown on a molar, tooth most likely be crown or root canal or missing an implant. What material?
My go-to material would be monolithic Emax, and only because, and it's funny, so everyone's going to tell me zirconia is stronger. Okay, so if I want to hang a picture on my wall and it weighs 10 pounds, do I need a lag bolt that's this big? No, but it's stronger. Well, okay, it'll work, and I'm not putting zirconia down, but here's what I am putting down about zirconia at this point in time. It's still ugly. Okay, they look like little bars of soap, and when you make them more translucent, they become weaker. Emax is chameleon-like; it blends with the adjacent teeth, and it's.
Do you cement it or bond it?
I cement almost all my Emax crowns, unless there was something
with what?
Unicem, Reliax Unicem.
By 3M.
Pre-mixed yellow capsule.
Triturated?
Yeah, triturated. Goes in the gun. Inject.
So you cement. Monolithic Emax with
Unisem.
Unisem.
Yep. Almost daily. With so few issues. And I've been doing this for a long time. So few issues. I will only go to zirconia if there's a space issue or, they're just a huge bruxer.
So what are your thoughts on gold? Like I have 7 restorations in my mouth. They're
I
all
love
gold.
Do
you do any gold anymore?
Yes, I still.
Is it only on old, fat, bald grandpas?
No, it's on.
Do women ever let you do it?
Yes, I have done a gold crown on a woman. Yeah.
Well, you talking about one? You talking about one?
I'm saying recently.
Recently.
But and actually, I don't know if you know that you can mill gold crowns today. So we actually can take the impression, design them, scan the die, and then I think it's called Strategy Milling Center. They might be the only place in the U.S. they mill gold crowns.
Strategy?
I think it's Strategy. You have to look that up online.
And while we're out here in Scottsdale, there's a milling denture company up the street. What is it? Avicam?
Yeah, I haven't been there, and I have no interest in doing that yet because
AccuView?
what's it called? Avident.
Avident.
Yeah. The only reason I have no interest in doing that is because it takes me out of my comfort zone and workflow of making dentures. And it's not better, faster, cheaper. It's going to cost more money.
Do you like dentures?
I love making dentures. You can send me every denture patient.
Wow. And you like veneers? Tell me what your average
I like single tooth molar implant supported crowns. So like here, I put this in. This is if I can do this all day for the rest of my life, I would love this. This is my go-to restoration. I would like to do single molars, custom abutments with the Emax crown, monolithic, cemented to the titanium custom abutment in the laboratory. Okay, and then all I do is remove the healing abutment, clean the area, and insert the crown, and then close the screw access hole. This is my go-to.
I want to ask you a very controversial question about implants.
Okay.
When these people are trying to sell their implants, they find people who lost anterior teeth from Streptococcus mutans decay, sink them in, cement, and they say it's a 95% success rate. But you were trained in perio, and the reality is more people probably lose their teeth from gum disease.
Right.
So what do you think the success rate is of a single implant in a mouth that has a lot of other natural teeth has battled gum disease for decades in the past?
It's hard to say. And I think, here's another thing that's hard to say. Who placed the implant? Who made the crown? What was the lab work? How well is the occlusion? And how good is the oral hygiene of the patient? I think there's so many factors that it's hard to say. Now, if you ask me this, in my office, because I'm seeing my work now over the last 20, 25 years, I can say this is probably one of the most successful things I've done because I'm monitoring patients now long term. I'm getting to see my results. And yet I have patients that are totally healthy without periodontal disease, and they'll lose 2-3 millimeters, maybe 4 around an implant over time. And so I used to think these were forever. I don't think it is forever anymore.
But when they lost 4 millimeters of bone, it's still in there.
It's still in there, and it's working. Let me give you an example. I have an implant, lower left molar. I have probably 3-4 millimeters of bone loss around it. Radiographically, it doesn't look great. However, I have no pain. It still works. I can chew and eat, and it's fine. But I'm thinking now it's not going to last forever. So to me, when do you start dentistry on a particular patient? That brings up a whole nother topic.
Would you say that dental implants was the largest game changer in your 3 decades out of dental school?
Yeah.
Or one of them?
I'd say dental implants, and then now materials. Dental materials are just going crazy. And then throw in all the CAD/CAM stuff now. So I think the whole thing is a game changer, but I still think it always comes down to you have to know what you're doing.
Okay, it's Memorial Day. I've already gone 15 minutes over the hour you promised me. So my last question.
Yep.
If you could only ride one thing, would it be a bike or a horse?
Bike. I know. Oh, bike. I don't ride the horses. So.
Well, there's 2 horses right outside there.
No, they scare me.
Really?
Yeah.
Oh my.
Yeah.
Are you still riding a lot?
Yeah, I rode this morning.
Yeah, how far did you ride?
30 miles this morning.
My favorite bike ride is from my house to the fountain at Fountain Hills.
Oh, it's great.
And back.
Oh, I love that ride.
Yeah, Fountain Hills.
On the
Amazing
Beeline?
ride. Yeah.
Yeah. Great.
I got to ask you one question. There's a big threat on Dental Town on biking. bikes are dangerous.
Yeah.
I mean, Ryan and I were talking about this morning. This morning, Ryan was on a 6 mile run, and an old lady, an old grandma, almost killed you. Yeah, she just an old lady looked down and hit the curb and bounced.
So basically,
are you scared when you're out there riding?
I mean, yes and no. Let me say this: I'm paying attention. Okay, I'm not scared. If I was scared, I wouldn't do it. But I'm concerned.
And did you pick that up?
And I'm paying attention.
The married men aren't scared. The single guys are scared. We have something to live for. The married men, they're like, I'm not scared. You can run over me. No, I'm just kidding.
No, I don't want to.
Hey, so now the last question. I'm on my knees begging.
Okay.
How can my homies get you to make us some online C? What do we have to do? We have to kidnap your 2 horses and hold them ransom?
I can do it as long as there's no time.
Sure. All I can promise you is that the time you spend making a course on Dental Town, more people will view that digitally than you could ever do in person.
Yeah,
doing
absolutely.
The Pony to Pony show, and it's a huge honor. And by the way, I got to embarrass you.
Yeah.
When I first met this man, was it in '87?
Well, I moved here in '90, so
it was '90.
I mean, but I've been coming out here. So
you had this gorgeous hair with a ponytail. When I first saw you, I thought of myself, that kid's got to be a hippie from New York.
I scared a lot of people.
Were you a hippie when you got out of school?
No, it wasn't I was a hippie, but I was a musician forever. So I was always playing in bands, and I lived through the 80s.
It was more of a Steely Dan look,
not a whole like '70s, '80s hair band. So like I was just part of that whole thing.
I never put the two together. I just thought you were a hippie.
No, it was
because I was from Kansas. If you would have walked into Kansas or any bar in Texas the way you looked when I first met you, they'd have said, "Oh,
me time."
You had a long ponytail.
I just watched last night, the story of Kansas, the band. Their story.
Really?
Oh, was that wonderful?
Where would you watch that on? Was that played?
A DVD.
Oh, a DVD.
I bought the DVD. It's their 20 or 25th anniversar now, but it's awe-inspiring.
And one thing I keep telling Ryan I have to do, one of my favorite shows every year is the last weekend of April, the introductory to the Rock and Roll Hall of Fame.
Oh, yeah.
And what I love about, I got to write a column on this because I've been a big fan of that show because, 5 or 6 maybe inductees every year.
Yeah.
And when they start talking, it doesn't matter if you make it to the top of dentistry or music or sports. Those speeches are like, they'll say things like, I'd like to give credit to my band manager who's been with us 30 years.
Absolutely.
So you're showing not a lot of staff turnover. I still have my dental assistant of 30 years. Just holding the team together.
Right.
Look at how many great bands all broke up.
Oh,
how many of them all died because of drugs?
That's sad.
So we have dentists dying of substance abuse. We have them staff turnover, and I wanted to someday I'd like to print out the acceptance speech of about 20, 30, 40 bands that made it into the Rock and Roll Hall of Fame, and kind of make an Excel spreadsheet of what things that they mentioned because they're pretty much mentioning the same things.
Matter of fact, this past year, Deep Purple got in, one of my favorite bands of all times.
Everybody can play that on the piano. Da, 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 da.
Smoke on the water.
Smoke on the water. Hey, thank you so much,
Howard,
buddy.
Thanks. Ryan, thanks.